impulses. And having the family focus on the client's symptoms, B, will not help the client learn to manage them. Number 3, the nurse is making discharge plans for a client with generalized anxiety disorder. What is the best criterion for discharge? The client will A, be without further severe levels of anxiety, B, consciously suppress anxiety symptoms, C, identify the situations and stresses that trigger anxiety, or D, understand the need to take medications for several years. The best criterion is letter C. The client can identify situations and stresses that trigger anxiety so that she can learn new ways to cope with the anxiety. The client may experience severe levels of anxiety after discharge, criterion A, but she needs to learn to identify situations and triggers of anxiety. Suppression is a conscious defense, and rather than suppress anxiety, the client needs to learn effective coping mechanisms. Clients with anxiety might not need to take medications for several years, criterion D. Number 4, the nurse plans to assess whether or not a client has been experiencing anxiety. Which questions should the nurse ask? A, have you had difficulty concentrating lately? B, have you been feeling more sad and lonely? C, can you tell me about any unusual experiences you've had? Or D, do you often feel angry and upset? The nurse should ask letter A, if the client has experienced difficulty concentrating. The inability to think and concentrate is related to anxiety. As for B, feelings of sadness and loneliness aren't defining criteria for anxiety. And C, unusual experiences are usually related to thought disorders. Finally, D, the client may experience feelings of anger, but it isn't one of the most important assessments for anxiety. Number 5, the nurse is working with a client who has obsessive-compulsive disorder. The nursing problem is impaired social interaction. What is the best treatment outcome for the client? The client will A, ask peers to be with her during compulsive activities, B, talk about her irrational thoughts in group, C, avoid obsessing during the interaction with the nurse, or D, describe more control over intrusive thoughts. The best treatment outcome is D. The client will describe more control over intrusive thoughts. For example, if the client has a frequent urge to wash her hands, she can control these thoughts by thought stopping, saying "stop" to herself when the obsession comes to mind. Let's talk about thought disorders, like psychosis. Which of the following are symptoms of psychosis? Hallucinations, mood swings, delusions, sleep disturbances, disorganized thoughts, disorganized behaviors? Hallucinations, yes. Hallucinations can be related to any of the 5 senses. Most hallucinations are auditory, 20% are visual, and the remaining are gustatory or taste, tactile or feel, olfactory, which is smell, or kinesthetic, which involves the awareness of body movement. In other words, clients might smell flowers when there are none, feel bugs on their skin when there are none, or taste or smell something they haven't eaten or smelled. Mood swings? No, mood swings are seen with mania or bipolar disorder. Delusions? Yes. Delusions are fixed, false beliefs that can be somatic, persecutory, grandiose, or paranoid. For example, a paranoid delusion may be that a client believes that a neighbor has been listening through the walls of his apartment. A somatic delusion involves body functioning or manipulation of a body part. An example of a somatic delusion is when a client believes that someone is trying to take his brain out of his head. Sleep disturbances? No. Sleep disturbances can occur with psychosis, but they're not a primary symptom of psychosis. Disorganized thoughts? Yes. The client may demonstrate loose associations, incoherence, go off on tangents, or use illogical or distractible speech. Disorganized behaviors? Yes. Disorganized behaviors include actions that are not goal-directed, unusual mannerisms, and difficulty carrying out a purposeful task. So, what are some key nursing diagnoses for clients with psychosis? altered thought processes, altered sensory perception, impaired verbal communication, confusion, ineffective individual coping, effective or ineffective management of the therapeutic regimen, altered role performance, self-care deficit, impaired social interaction, social isolation. Remember, safety first. Interventions in the acute phase of psychosis include safety because a client is at risk for self-harm due to poor judgment or in response to delusions or hallucinations, especially command hallucinations. Let's observe a nurse's interaction with a client who is hallucinating. How many interactions can you identify? In this scenario, the nurse asks the client if he's hearing voices. The nurse is recognizing nonverbal cues that suggest the presence of hallucinations, so she's questioned the client and is patiently waiting for an answer. This patience shows acceptance of the client. The nurse asks what the voices are telling him. She's assessed for command hallucinations that may lead the client to act in a certain way. The nurse says she's not hearing any voices except for his voice. The nurse stays with the client and does not leave the client alone. The nurse asks when the client started hearing the voices. The client says he doesn't know, maybe a year ago. The nurse asks the client what kinds of things make the voices get louder. And the client says, being in the car or when he's outside. These were the nurse's interventions. 1. Observe for nonverbal clues that suggest the presence of hallucinations. 2. Ask the client if he's hearing voices. 3. Be patient. Show acceptance of the client. 4. Assess for command hallucinations that may lead the client to act in a certain way. 5. Respond to the client and let him know that you're not experiencing the hallucination. 6. When the client is hallucinating, stay with him. 7. Encourage the client to remember when his hallucinations began and any possible triggers. And 8. Educate the client about ways to cope with his hallucinations. Watch TV, listen to the radio, talk to a friend, wear headphones, say stop, tell the voices to go away, walk, sing, take extra medication, only as prescribed. An example of an important treatment outcome for hallucinations includes clients will report hearing fewer voices or demonstrate or identify at least 3 ways to cope with the voices or other hallucinations. Delusions are another symptom of psychosis. Delusions are fixed, false notions that the client firmly believes. Consider the following barriers to successful intervention for delusions. How many can you identify? In this interaction, the nurse tells the client it's time to go to her stress management group. The client says she's not here for stress. She says she's in the hospital to have her 12 babies. The nurse smirks and says, 12 babies, are you sure? And the client responds with a yes. The nurse says that there's no way a person could have 12 babies and tells the client that she's in a mental health unit. The client, now agitated, tells the nurse that she doesn't know what she's talking about. The nurse responds by telling the client that she's sure everything will work out fine. Did you find these barriers to successful intervention? 1. The nurse's anxiety led to discounting the client and questioning, 12 babies, are you sure? 2. The nurse tried to logically explain that the client's belief was untrue and the client became more irritable. 3. The nurse reinforced the delusion by stating, okay, I'm sure everything will work out fine. A more successful intervention would be to respond to the underlying feeling by saying, you must be feeling very overwhelmed, rather than trying to explain that it's illogical. The nurse can also listen quietly until there is no need to discuss the delusion. It's also important to question the facts carefully, in a way that doesn't cast doubt on the client's beliefs.